Gentlemen, I am Jessica telling you some things. Toast this ideas in gym for penis to make strong and beautiful. Let me ask you something. You train your arms, your chest, maybe even your calves at the gym, but have you ever thought about training your penis? Yes, you heard that right. Just like your muscles need regular exercise to stay strong and responsive, the tissues inside your penis also need conditioning to stay healthy, elastic, and capable of producing reliable erections. If that sounds surprising, stick with me, because by the end of this video, you'll not only understand why this works, but also how to safely take your penis to the gym with a simple science-backed exercise that can help protect you from erectile dysfunction as you age. Before we dive in, do me a quick favor. Hit the like button so more men can discover this information. And drop a comment below telling me where you're watching from. I love seeing our community of men's health warriors from around the world. And of course, subscribe if you want more straight-talking science-based advice that keeps you strong and confident at every stage of life. All right, let's get into it. There's a myth floating around that erections are just about desire and performance in the bedroom. But here's the truth. Erections are also about vascular health and muscle health. Inside your penis are two spongy chambers called the corpora cavernosa. These aren't just empty spaces. They're made up of specialized smooth muscle fibers and blood vessels. When you're aroused, your brain signals nitric oxide to relax those muscles. Blood rushes in, and the veins at the base are compressed, trapping blood so the erection stays firm. Now, here's the catch. Just like any other muscle in your body, if these erectile tissues aren't used and oxygenated regularly, they can stiffen, lose elasticity, and develop scar like tissue called fibrosis that makes erections weaker and less reliable. So the real myth-busting truth is this. Erections aren't only about testosterone or attraction. They're also about keeping the erectile tissue itself conditioned. And that's where the penis gym comes in. For those of you new here, a urologist with 12 years of experience helping men restore confidence, vitality, and sexual health. I've worked with men in their 20s, men in their 80s, and everything in between. And I can tell you erectile dysfunction is not just about aging. It's about circulation, hormones, and yes, tissue fitness. Think of it like this. If you put your arm in a cast for 6 weeks, the muscles shrink. If you stop moving your penis, whether because of stress, illness, or reduced sexual activity, the tissues inside can also decondition. That's why men who stay sexually active or who deliberately exercise their erections often maintain better function into later life. Now, okay, doc, what's the workout? How do I actually exercise my penis safely? That's exactly what we're getting into. Let's break this down into the 4 most common mistakes men make with their erections and how to fix each one. Mistake number 1, relying only on spontaneous erections. Most men think that if they're still getting morning wood, they're in the clear. But here's the problem. Nocturnal erections can decline with age, stress, poor sleep, or health issues like diabetes or high blood pressure. Biologically, those nighttime erections are your body's way of aerating the erectile tissue, bringing in oxygen-rich blood, and keeping the muscle fibers pliable. Without them, fibrosis creeps in. Practical fix. You can't just rely on nature to do the job for you anymore. That's where the vacuum erection device, sometimes called a penis pump, comes in. Used properly, it draws fresh, oxygenated blood into the penis, giving those tissues the workout they need. Mistake number 2, thinking more pressure equals more results. This is where a lot of men go wrong. They think pumping harder or longer will make their penis bigger. That's not how this works. Biologically, the goal isn't to stretch it like a balloon. The goal is to gently engorge the tissue, oxygenate it, and train the veins and muscles to hold blood efficiently. Too much pressure damages vessels, leading to bruising and even scar tissue. Practical fix, slow, gentle intervals. Think of it like doing reps at the gym. Pump slowly to a full, comfortable erection. Hold for about 30 to 60 seconds. Release and repeat for about 10 minutes. That's your set. Nothing extreme, nothing painful, just consistent training. Mistake number 3, ignoring the lifestyle piece. Let's be real, you can't outpump a bad lifestyle. Smoking, heavy drinking, untreated sleep apnea, belly fat, high blood pressure, these all choke blood flow and lower testosterone. Biologically, if your arteries are clogged, Your penis is the first place it shows. Why? Because the penile arteries are only about the width of a spaghetti noodle, far smaller than your coronary arteries. If blood isn't flowing well there, it's a red flag for your heart and brain too. Practical fix. Walk 30 minutes most days. Do strength training twice a week. Cut back on alcohol. Quit smoking. Sleep like it matters, because it does. Your penis gym only works if your whole body gym is in order. Mistake number 4, thinking it's just about size. This one is emotional. Many men pick up a pump thinking it's a shortcut to adding inches. And when that doesn't happen, they give up. Here's the truth. The durable benefit isn't permanent size increase. It's function. It's firmer, more reliable erections. It's confidence in intimacy. It's dignity and freedom. The ability to perform without fear. Practical fix. Shift your mindset. This isn't about building a bigger penis. It's about building a healthier one that stays strong for decades. Here's the simple weekly routine I give to many of my patients. 3 to 5 days per week. Do a 10-minute vacuum device interval session. Pump gently. Hold 30 to 60 seconds. Release. Repeat. Add pelvic floor exercises. During rest periods, practice gentle chelate contractions. 3 seconds on, 3 seconds off for 5 reps. This strengthens the base muscles that support erections. Daily movement. Walk or move every hour if you sit a lot. Blood flow matters. Strength train twice a week. Push, pull, squat, hinge, build muscle, protect testosterone. Sleep 7 to 8 hours. That's when your natural testosterone and erections recharge. Optional if your doctor approves. Pair your session with a natural nitric oxide booster like L-citrulline from watermelon extract. It helps blood flow and makes the exercise even more effective. Now, I want to pause here, because if you're a man watching this and thinking, "Doc, I feel like my best days are behind me," I want you to hear me clearly. That's not true. Erectile function is not just about youth, it's about habits. I've seen men in their 70s and 80s who still enjoy satisfying, confident intimacy. Why? Because they kept their circulation healthy, their hormones balanced, and yes, they exercised their erections. This isn't about being a porn star. It's about being the best version of you, feeling comfortable in your body, confident with your partner, and free from the anxiety that comes with unreliable performance. So here's your takeaway. Use it or lose it. Treat your penis like the valuable muscle it is. Train it gently, consistently, and smartly. Combine that with lifestyle habits that support blood flow and hormones. And remember, it's never too late to start. If this video helped you, do 2 quick things for me. Hit the like button so more men can find this information. Drop a comment telling me what's one healthy habit you're committing to this week. And if you haven't already, subscribe for more science-based men's health advice. No shame, no fluff, just real answers you can use. Gentlemen, aging is not the end of vitality. With small, intentional steps, you can protect your erections, your confidence, and your freedom for years to come. You deserve that. Reminding you, take care of your health, because you are absolutely worth it.